Hello, everyone. How are you doing? In today's video, we're going to talk about a super important topic, especially for those who are pregnant or know someone who is expecting a baby and has diabetes. The treatment of diabetes mellitus during pregnancy is quite different from treating people who aren't pregnant, and this is because, in this phase, care needs to be fast and very precise. The health of both the mother and the baby depends on this strict control, and I'll explain everything about how this treatment works. Let's understand more about this together. When a woman discovers she has gestational diabetes, the first thing doctors usually recommend is a lifestyle change. This means paying more attention to your diet and, if possible, trying to engage in some physical activity, of course, always with the doctor's guidance. These simple steps often help control blood sugar levels and can prevent bigger problems. Additionally, the mother-to-be will need to monitor her blood glucose, the sugar level in her blood, quite frequently. There are two main times to measure it: in the morning, before eating anything, fasting glucose, and after meals, postprandial glucose. The Brazilian Diabetes Society, SBD, recommends that this measurement be done 1 hour after each meal, and the doctor will reassess the results after 1 or 2 weeks to see how things are going. Now, it's possible that not every pregnant woman can measure her blood sugar every day. In some cases, when there are financial limitations, measuring it 3 times a week can already give a good idea of how glucose levels are behaving. But ideally, the monitoring should be strict to ensure everything stays under control. If diet and lifestyle changes aren't enough to control gestational diabetes, doctors refer to this as a diet failure. This term is used when, in 2 or more measurements, blood glucose is above the target. And what are these targets? Well, fasting glucose levels should be no higher than 95 milligrams per deciliter. 1 hour after meals, the value should not exceed 140 milligrams per deciliter. And, if the measurement is taken 2 hours after eating, the ideal number should be below 120 milligrams per deciliter. If the numbers remain high, even with dietary changes, treatment needs to be more aggressive. This is when insulin comes into play. Insulin is the preferred treatment for pregnant women when diet isn't enough. The insulin dosage is individualized, meaning each patient will need a specific amount, and the doctor will adjust it as needed. Blood glucose targets for pregnant women are stricter than for those with type 2 diabetes, for example. This is because the pregnant body undergoes many changes, and control needs to be more rigorous. Usually, the doctor starts treatment with a low dose of basal insulin, which is the slower-acting insulin, and increases it as needed. For glucose spikes that happen after meals, regular insulin may be an option, depending on the patient's response. If necessary, the doctor might also recommend using metformin, which is a medication typically used to treat type 2 diabetes. In pregnancy, metformin is indicated when there's a need to reduce the insulin dose or control the mother and baby's weight gain. For women who already had diabetes before pregnancy, the story is a bit different. If they were already taking oral medications to control blood sugar, these medications should be discontinued as soon as pregnancy is confirmed, and insulin treatment should begin. Starting from the 2nd trimester of pregnancy, things can get a bit more complicated. At this stage, the need for insulin usually increases because the placenta begins producing hormones that cause the mother's body to become more resistant to insulin. In other words, the insulin that the body produces naturally or is injected ends up not working as well as before, and doctors need to adjust the doses. NPH and regular insulins are the most recommended during pregnancy. They are considered safe for controlling blood glucose levels without posing major risks to the baby. On the other hand, long-acting insulins, such as Glargine, have some restrictions because there's a risk of unwanted effects, like the growth of certain cells. However, detamir insulin has shown more favorable results and can be used more safely to maintain glycemic control. So, this whole process requires a lot of attention, medical monitoring, and frequent adjustments to ensure that both the pregnant woman and the baby stay healthy throughout the pregnancy. Now tell me, have you or someone you know experienced gestational diabetes? How was it dealing with these lifestyle changes and glucose control? Leave your experience in the comments. The importance of a balanced diet. When you're pregnant and managing diabetes, every meal becomes a powerful tool for keeping glucose levels in check. The idea is not to make things too complicated, but to make smart choices. Eating in a balanced way helps avoid glucose spikes, which can be harmful to both the mother and the baby. The key here is to combine carbohydrates, proteins, and fats in the right way and in the right amounts. This helps the body release glucose slowly, avoiding those highs and lows that can throw diabetes off balance. Spreading out meals throughout the day. An important tip is not to go too many hours without eating, and at the same time, not to overeat in one sitting. The ideal is to have several small meals throughout the day. This helps keep blood sugar levels more stable and prevents sudden hunger from kicking in all at once. For example, you can have 3 main meals, breakfast, lunch, and dinner, and 2 or 3 snacks in between. This way, your body is getting a constant supply of energy, which helps avoid both sudden spikes and drops in blood sugar. Choosing the right carbohydrates. When we talk about diabetes, one of the first things that come to mind is carbohydrates, which are the type of nutrient that most affects blood glucose levels. But this doesn't mean you need to cut all carbs from your diet. The secret lies in making the right choices. There are 2 main types of carbohydrates, simple and complex. Simple carbohydrates are those that the body absorbs quickly, like refined sugar, sweets, white bread, and white rice. These can cause a rapid increase in glucose levels. On the other hand, complex carbohydrates are those that the body absorbs more slowly, like those found in whole grains, whole wheat bread, brown rice, oats, legumes, and vegetables. These are great because they release glucose gradually and help maintain more stable blood sugar levels. During pregnancy with diabetes, it's very important to prioritize complex carbohydrates and avoid over-consuming simple carbs. Proteins and healthy fats are your friends. In addition to carbohydrates, proteins and healthy fats also play an important role in the diet of a pregnant woman with diabetes. These nutrients help provide satiety, and together with complex carbohydrates, they help glucose release more slowly into the bloodstream. So, it's essential to include sources of lean protein, like chicken, fish, eggs, and legumes, in your meals. In addition, healthy fats, such as olive oil, avocado, and nuts, are also good options. Watch portion sizes. Another key tip is to pay attention to portion sizes. Even if you're eating healthy foods, it's important not to overdo it because that can cause a spike in glucose levels. That's why following the guidance of a nutritionist or doctor is super important. They will help determine the ideal amount of each food group so you can keep blood sugar under control while providing the necessary nutrients for the baby's healthy growth. How to build the ideal plate. When putting together your plate, always think of a balanced combination of foods. An ideal plate for a pregnant woman with diabetes could be divided like this. Half of the plate with vegetables, preferably raw or steamed. A quarter of the plate with a source of lean protein, such as chicken, fish, or legumes. A quarter of the plate with a complex carbohydrate, such as brown rice, sweet potato, or quinoa. A portion of healthy fat, such as a drizzle of olive oil over the salad or some nuts on the side. This type of combination helps keep blood sugar in check and ensures that both you and the baby receive all the necessary nutrients. Avoid foods with a high glycemic index. The glycemic index is a measure that shows how quickly a food raises blood sugar levels. The higher the glycemic index of a food, the faster it increases glucose levels in the blood. Foods like white bread, white rice, sodas, fruit juices, and sweets, for example, have a high glycemic index. Therefore, it's better to avoid or consume these foods in moderation. On the other hand, foods like oats, sweet potatoes, brown rice, vegetables, and fruits with a low glycemic index are better options for controlling blood sugar. They help maintain more stable blood sugar levels. Drink plenty of water. Hydration is also essential. Drinking plenty of water throughout the day helps keep your body functioning well and also aids in controlling glucose levels. Try to drink at least 8 glasses of water a day, and avoid sodas and store-bought juices, which can contain hidden sugars. A final word on nutrition. Diet is one of the most powerful tools for managing diabetes during pregnancy. Making balanced choices, opting for nutrient-rich foods, and avoiding those that can quickly raise glucose is the right path to ensure the health of both mother and baby. Remember, the most important thing is to always follow the advice of your doctor and nutritionist and make adjustments to your diet as necessary. With a good diet, regular glucose monitoring, and proper treatment, you are on the right track to a healthy pregnancy. Are you finding these tips helpful for achieving a balanced diet? Share this video with anyone who needs to know more about this topic. Let's talk now about monitoring through fasting and postprandial capillary glucose tests. What are capillary glucose tests? Have you ever heard of glucose tests done with a small prick on the finger? Well, these are capillary glucose tests, and they are super important for anyone who is pregnant and has diabetes. These tests are simple. Using a device called a glucose meter, you collect a tiny drop of blood from your finger, and the device measures the amount of glucose in the blood at that moment. It may seem complicated at first, but with practice, it becomes a part of your daily routine. Why monitor fasting glucose? One of the most important times to check glucose levels is first thing in the morning, before eating anything. This is called fasting glucose. The reason for testing right after waking up is that the body has gone several hours without food overnight, so blood sugar should be at a stable level. If fasting glucose levels are high, it could indicate that the body is not efficiently controlling blood sugar during the night. This might be a sign that the treatment or diet needs adjustments. That's why doing this test every day is so important. Monitoring post-meal glucose. Another key time to measure blood glucose is after meals. This is called the postprandial glucose test, usually done 1 to 2 hours after eating. This test helps to see how your body is handling food and whether blood sugar levels are rising more than they should. For example, if glucose spikes a lot after a meal, it may mean that too many carbohydrates were consumed, or it could indicate the need to adjust medication or the meal plan. What are the glucose targets? During pregnancy, it's essential to keep glucose levels within a specific range. The targets for glucose levels can vary, but generally, doctors recommend fasting glucose between 70 mg per deciliter and 95 mg per deciliter. Glucose 1 hour after meals, below 140 mg per deciliter. Glucose 2 hours after meals, below 120 mg per deciliter. These values may change according to your doctor's advice, but it's crucial to stay within these numbers to ensure everything is under control. If levels are frequently outside the target range, it might mean the treatment needs adjustment. How to perform a glucose test. Performing a glucose test is quite simple and, over time, it becomes a routine task. Here's a basic step-by-step guide. 1. Wash your hands well. First, make sure to wash your hands thoroughly to avoid any residue that could interfere with the result. 2. Grab your glucose meter. The glucose meter should be ready for use. You'll also need a lancet, the small needle used to prick your finger, and a test strip. 3. Prick your finger. Use the lancet to make a small prick on the side of your finger. It hurts very little, like a small pinch. 4. Collect the blood drop. Bring the glucose meter close to the blood drop and apply it to the test strip. 5. Wait for the result. In just a few seconds, the glucose meter will show you your blood sugar level. 6. Record the results. It's important to log your results in a notebook or an app to take to your doctor's appointments. How often should you measure your glucose? The frequency of glucose testing can vary depending on your doctor's advice. But generally, pregnant women with diabetes need to check their blood sugar levels at least upon waking up, fasting, after main meals, breakfast, lunch, and dinner. In some cases, your doctor may ask you to test more often throughout the day, especially if your glucose levels are out of control. What to do if your glucose is out of range? Sometimes, even when following everything correctly, glucose levels can be higher or lower than expected. If this happens occasionally, don't panic. But if it happens frequently, it's important to talk to your doctor to adjust the treatment. If glucose levels are too high, hyperglycemia, you may need to adjust your diet, medication, or even the amount of physical activity you do. On the other hand, if levels are too low, hypoglycemia, it's important to quickly correct it by eating something with sugar, like a fruit juice or candy. Then, discuss with your doctor to understand why this happened and make any necessary adjustments to the treatment. A final note on monitoring. Monitoring blood glucose is one of the most important aspects of managing gestational diabetes. It's like a thermometer that shows if the treatment is working or needs tweaking. Plus, it helps prevent complications for both mother and baby. Remember that regular monitoring, along with a balanced diet and medical guidance, makes all the difference in staying healthy during pregnancy. Controlling glucose levels may seem challenging at first, but it becomes a routine and helps ensure a safe and healthy pregnancy. The SBD guidelines recommend measuring blood glucose 1 hour after meals, with reassessment between 7 and 15 days. Have you ever heard of blood glucose tests done with a small prick on the finger? Well, those are capillary blood glucose tests, and they are super important for pregnant women with diabetes. These tests are done simply. With a device called a glucometer, you collect a small drop of blood from your finger, and the device measures the amount of glucose in your blood at that moment. It may sound complicated, but with practice, it becomes part of the daily routine. Why monitor fasting blood glucose? One of the most important times to check glucose levels is first thing in the morning, before even having breakfast. This is what we call fasting glucose. The reason for doing this test right after waking up is that, during the night, the body goes several hours without receiving food, so blood glucose should be at a stable level. If fasting blood glucose levels are high, it may indicate that the body is not effectively managing blood sugar levels during the night. This could be a sign that treatment or diet needs adjustments. That's why it's so important to do this test every day. Monitoring post-meal blood glucose. Another crucial time to measure blood glucose is after eating. This is the postprandial glucose test. Normally, it's done about 1 to 2 hours after a meal. This test helps check how your body is handling the food and if glucose levels are rising more than they should. For example, if glucose levels rise too much after a meal, it might mean you've consumed more carbohydrates than your body can process, or it may indicate the need to adjust your medication or diet plan. What is the target glucose level? During pregnancy, it's super important to keep glucose within a specific range. The target glucose levels can vary, but generally, doctors recommend. Fasting glucose should be between 70 mg per deciliter and 95 mg per deciliter. 1 hour after meals should be below 140 mg per deciliter. 2 hours after meals should be below 120 mg per deciliter. These values may vary depending on your doctor's recommendations, but the important thing is to closely monitor these numbers to ensure everything is under control. If levels are frequently outside the target range, it could indicate that the treatment needs adjusting. How often should you measure glucose? The frequency of glucose monitoring can vary based on your doctor's recommendations. But in general, pregnant women with diabetes need to check their glucose levels at least upon waking up, fasting, after main meals, breakfast, lunch, and dinner. In some cases, the doctor may ask you to measure more often throughout the day, especially if glucose levels are very out of control. What to do if glucose levels are out of target? Sometimes, even when doing everything right, glucose levels can be higher or lower than expected. If this happens occasionally, there's no need to panic. But if it happens frequently, it's important to talk to your doctor to adjust your treatment. If glucose levels are too high, hyperglycemia, it may be necessary to adjust your diet, medication, or even the amount of physical activity you do. On the other hand, if levels are too low, hypoglycemia, it's important to quickly correct this by eating something with sugar, like fruit juice or candy. Afterward, you should talk to your doctor to understand why this happened and adjust the treatment if necessary. Now, let's talk about a situation that often happens when financial resources are limited. We know that frequently measuring blood glucose can be a challenge, especially for those who don't have easy access to test strips and devices. But even so, it's still possible to monitor health efficiently. Measuring glucose 3 times a week. If a pregnant woman cannot measure her blood glucose every day, the recommendation is to do it 3 times a week. During these measurements, it's important to choose strategic moments, such as 1.1 fasting day, to check the blood glucose level first thing in the morning, before eating. 2.1 day after breakfast, to see how the body reacts to the first meal of the day. 3.1 day after lunch or dinner, to check the glucose peak after a larger meal. Even with this reduced frequency, monitoring will still be helpful in understanding blood glucose control. Of course, daily measurements would be ideal, but this adjustment is valid when there are limitations. How to adapt the treatment. In these cases, the patient must be even more attentive to body signals and strictly follow recommendations on diet and physical activity. Keeping a glucose log, recording measurements and any symptoms, helps the doctor adjust the treatment, even with fewer available data. Finally, even with limitations, it's essential not to skip appointments and to stay in touch with the doctor to ensure the best possible follow-up. A very important point is diet failure, which is defined when 2 or more blood glucose measurements are outside the target range, fasting greater than 95 mg per deciliter, 1 hour postprandial greater than 140 mg per deciliter, or 2 hours greater than 120 mg per deciliter. What is diet failure? Diet failure occurs when 2 or more blood glucose readings show numbers that are not within the safe range. The limits are as follows. Fasting glucose should be below 95 mg per deciliter. 1 hour after meals, glucose level should be below 140 milligrams per deciliter. 2 hours after meals. Ideally, it should not exceed 120 milligrams per deciliter. If a patient notices that 2 or more measurements are above these values, it's a sign that the diet or treatment may need to be reviewed. What to do in case of diet failure? When this happens, it's important to act quickly. The pregnant woman should contact her doctor to discuss the results and possible adjustments to the diet or treatment. This might include adjustments in diet, such as reducing sugars or increasing fiber intake, increasing physical activity, with safe and appropriate exercises for pregnancy. It's essential to remember that even in the face of difficulties, medical monitoring is crucial to ensuring the health of both the mother and the baby. Next, we will address the importance of insulin in managing diabetes. Insulin is the pharmacological treatment of choice when diet fails, with individualized adjustments. What is insulin? Insulin is a hormone that helps the body use glucose, sugar, for energy. For pregnant women with diabetes, insulin is the recommended pharmacological treatment when diet alone cannot keep blood sugar levels under control. Why use insulin? When diet fails to control blood sugar levels, insulin may be needed to lower blood sugar levels. Insulin helps reduce the amount of sugar in the blood, preventing it from getting too high. Ensure the health of both mother and baby. Keeping blood sugar levels controlled is crucial for the well-being of both. Individualized adjustment. It's important to remember that insulin treatment is not one-size-fits-all. Every woman is unique and may need a different dose. The doctor will make individualized adjustments to ensure that each patient receives the right amount of insulin. This adjustment may depend on factors such as body weight, blood glucose levels, response to treatment. What to do? If insulin is prescribed, the patient should 1. Follow the doctor's instructions. It's crucial to take insulin as directed. 2. Monitor blood glucose regularly. This helps understand how insulin is working and whether blood sugar levels are within the target range. 3. Consult a nutritionist. A specialist can help create a meal plan that works well alongside insulin treatment. Blood glucose targets for gestational diabetes are stricter than for type 2 diabetes. Why are the targets stricter? During pregnancy, a woman's body undergoes many changes. These adjustments are necessary to ensure the baby develops healthily. Therefore, keeping blood sugar levels under control becomes even more crucial. Stricter targets help prevent complications for both the mother and the baby. What are these targets? Guidelines generally set the following blood glucose targets for women with gestational diabetes. Fasting. Less than 95 milligrams per deciliter. 1 hour after meals. Less than 140 milligrams per deciliter. 2 hours after meals. Less than 120 milligrams per deciliter. These targets are set to ensure that blood glucose remains at safe levels, reducing the risk of complications such as problems with the baby's growth. High blood sugar levels can cause the baby to grow too large, which may lead to difficulties during delivery. Risk of premature birth. Controlling blood glucose helps prevent the baby from being born prematurely. Long-term health. Keeping blood sugar under control during pregnancy can help prevent future health problems for both the mother and the child. How to achieve these targets? To reach these blood glucose goals, pregnant women should 1. Follow a balanced diet. Eating healthy foods in the right portions helps control blood sugar levels. 2. Engage in physical activity. Light activities, such as walking, can help lower blood sugar levels. 3. Monitor blood glucose frequently. This allows the patient to see how diet and physical activity are affecting blood glucose levels. Next, we will talk about different types of insulin. Basal insulin is often started with small doses, and the dosage is adjusted as needed. What is basal insulin? Basal insulin helps maintain stable blood sugar levels throughout the day and night, even when we're not eating. Unlike mealtime insulin, which is used to control spikes in blood sugar after eating, basal insulin is released slowly and continuously, helping to keep glucose levels steady over time. How does treatment begin? When a pregnant woman needs insulin, the treatment usually begins with small doses. This is important for several reasons. 1. Preventing low blood sugar. Starting with a smaller dose helps avoid hypoglycemia, low blood sugar. This is especially important during pregnancy, as both the mother and baby need adequate sugar levels to stay healthy. 2. Gradual adjustment. Every body responds differently to insulin. By starting with a small dose, doctors can monitor how the patient reacts to the treatment and make adjustments as needed. Dosage adjustment. As the treatment progresses, the basal insulin dosage is adjusted based on individual needs. Doctors typically review the patient's blood sugar levels regularly and may increase the dose if glucose levels are still out of range. This is crucial because body changes. As pregnancy progresses, a woman's body changes, and insulin needs may increase. Adjusting the dose ensures blood sugar remains controlled. Ensuring safety, proper insulin adjustment helps protect the health of both mother and baby. Keeping glucose levels within a healthy range is essential to avoid complications. The importance of monitoring. In addition to adjusting insulin, it is vital for pregnant women to continue monitoring their blood sugar regularly. This helps quickly identify if something isn't working as expected and if further treatment adjustments are necessary. Regular insulin can be used to control postprandial spikes, depending on the patient's response. What is regular insulin? Regular insulin is a form of fast-acting insulin. This means it starts working quickly, helping to reduce blood sugar levels after a person eats. It is different from basal insulin, which acts slowly throughout the day. How does it work? When a pregnant woman eats, the sugar from food enters the bloodstream. This can cause an increase in blood glucose levels, known as a postprandial spike. Regular insulin is administered to help control these spikes. Here's how it works. 1. Timing of administration. Regular insulin is typically injected about 30 minutes before a meal. This gives enough time for the insulin to start working when the sugar from food begins to enter the bloodstream. 2. Controlling the spikes. This insulin helps clear the sugar from the blood, bringing it back to normal levels. This is important to prevent complications for both the mother and the baby. The importance of adapting treatment. The use of regular insulin heavily depends on the patient's response. This means that each woman may react differently to insulin and her meals. Some women may need more regular insulin after meals, while others may need less. Here are some points to consider. Regular monitoring. It is essential for the patient to monitor her blood sugar levels before and after meals to understand how her body is responding to regular insulin. This helps adjust the doses correctly. Necessary adjustments. Depending on the response, the doctor may adjust the amount of regular insulin the patient should use. This ensures that blood sugar remains within a healthy range. Metformin may be indicated as second-line therapy, especially when there is a need to reduce high insulin doses or control maternal/fetal weight gain. What is metformin? Metformin is a medication that helps control blood sugar levels. It is often used in the treatment of type 2 diabetes, but it can also be indicated for pregnant women with gestational diabetes, especially when certain conditions are present. When is metformin used? 1. Second-line therapy. Metformin is referred to as second-line therapy. This means it can be used when insulin treatment is not sufficient or when the patient needs extra help. For example, if a woman is requiring very high doses of insulin to control her blood sugar, metformin may be a good option. 2. Weight gain control. Another reason metformin may be indicated is for controlling weight gain. Some women may gain excessive weight during pregnancy, and metformin can help manage this. This is important because excessive weight gain can pose risks for both the mother and the baby. How does metformin work? Metformin works in several ways to help control blood sugar. Reducing sugar production by the liver. It helps decrease the amount of sugar that the liver releases into the bloodstream. Increasing insulin sensitivity. Metformin also helps the body cells use insulin more efficiently, meaning they can absorb sugar from the blood better. Important considerations. Medical supervision. It is essential for women considering metformin to discuss it with their doctors. The doctor will assess each patient's individual situation and decide if metformin is the best choice. Safety during pregnancy. Although metformin is generally considered safe during pregnancy, it is always important to have proper monitoring to ensure the health of both the mother and the baby. Patients with pre-existing diabetes should discontinue oral hypoglycemics upon becoming pregnant and initiate insulin treatment. Discontinuation of oral hypoglycemics. 1. What are oral hypoglycemics? Oral hypoglycemics are medications that help control blood sugar levels. They are commonly used by people with type 2 diabetes but are not recommended for pregnant women. 2. Why discontinue? When a woman with pre-existing diabetes becomes pregnant, her treatment needs to be adjusted. This is because oral hypoglycemics may not be safe for the baby. Discontinuing these medications is important to minimize risks and ensure a healthy environment for the fetus's development. Initiation of insulin treatment. 1. Why use insulin? Insulin is the preferred treatment for pregnant women with pre-existing diabetes because it is safe for the baby. Unlike oral hypoglycemics, insulin does not cross the placenta, which means it helps control the mother's blood sugar levels without directly affecting the baby. 2. Necessary adjustments. After discontinuing oral hypoglycemics and initiating insulin, the doctor will adjust the doses as necessary. This is very important because insulin needs may change during pregnancy. Women may require more insulin as the pregnancy progresses. Monitoring and follow-up. 1. Frequent monitoring. With the transition to insulin treatment, it is essential for women to monitor their blood sugar levels frequently. This helps ensure that blood sugar levels remain within the target range and that the treatment is functioning properly. 2. Medical follow-up. Regular medical follow-up is crucial. The doctor will monitor the health of both the mother and the baby, adjusting the treatment as necessary to keep everything under control. The need for insulin increases in the second and third trimesters due to increased insulin resistance caused by the production of placental hormones. Increased insulin requirement. 1. What happens during pregnancy? During pregnancy, a woman's body undergoes many changes. One of the main factors is the production of placental hormones, such as estrogen and progesterone, which play crucial roles in the baby's development. However, these hormones can also lead to increased insulin resistance. 2. Insulin resistance. Insulin resistance means that the mother's body does not respond as well to the insulin it produces. This is normal during pregnancy, but for women who already have diabetes, it can become a challenge. As a result, they may require larger doses of insulin to keep blood sugar levels within the desired range. Adjusting insulin doses. 1. Frequent monitoring. As the woman progresses into the second and third trimesters, it is essential to monitor blood sugar levels more frequently. This will help identify when adjustments to the insulin dose are necessary. 2. Progressive adjustments. The doctor will monitor the results of the blood sugar tests and, based on this data, may increase the insulin dose as needed. It's like fine-tuning to ensure that both the mother and baby remain healthy. NPH and regular insulins are recommended as first-line treatment for gestational diabetes. NPH and regular insulins. First-line treatment. 1. What are NPH and regular insulins? NPH insulin, neutral protamine hagedorn, is an intermediate-acting insulin. This means it begins to work at a moderate pace and its effects last for several hours. On the other hand, regular insulin is a rapid-acting insulin that starts working quickly after administration and is used to control blood sugar spikes, especially after meals. 2. Why are they recommended as first-line? These insulins are recommended as the first-line treatment for gestational diabetes because they help maintain blood glucose levels within established targets. NPH is useful for covering insulin needs throughout the day, while regular insulin is effective in controlling blood sugar levels that rise after meals. Advantages of using NPH and regular insulin. 1. Efficient blood sugar control. These insulins help keep blood glucose levels more stable, reducing the risk of hyperglycemia, high blood sugar, and hypoglycemia, low blood sugar. Good control is essential for both the mother's and baby's health. 2. Flexibility. The combination of these insulins allows doctors to adjust treatment according to the specific needs of the patient. This is especially important since each woman may respond differently to treatment. 3. Safety. NPH and regular insulins have a long history of safe use during pregnancy, making them a reliable choice. Safety is a top priority when treating pregnant women, as medications must be effective without compromising the health of the mother or baby. Long-acting insulins, such as Glargine, have used restrictions due to the risk of mitogenic effects, while Detamir has more favorable evidence for glycemic control. Long-acting insulins, Glargine and Detamir. 1. What are long-acting insulins? Long-acting insulins, such as insulin Glargine, are designed to release insulin gradually throughout the day, helping to maintain stable blood glucose levels. This is especially useful for covering insulin needs during the night and between meals. 2. Use restrictions for insulin Glargine. Although insulin Glargine is effective, its use in pregnant women has certain restrictions. This is due to studies suggesting a potential risk of mitogenic effects, which are cellular changes that may increase the risk of tumors. Since safety is a priority during pregnancy, many doctors choose not to use this insulin in pregnant women. 3. Insulin detamere and its advantages. In contrast, insulin detamere shows more favorable evidence regarding glycemic control during pregnancy. It is considered a safer option for pregnant women with diabetes, as it does not carry the same risks associated with insulin glargine. Detamere also has a predictable duration of action, making diabetes management easier. Advantages of insulin detamere. 1. Effective glycemic control. Insulin detamere helps maintain blood sugar levels within desired ranges, reducing the risk of complications for both the mother and the baby. This is essential for a healthy pregnancy. 2. Lower risk of adverse effects. With fewer restrictions on its use, insulin detamere can be a viable alternative for women needing long-acting insulin, ensuring they can manage their blood sugar without the risks associated with other insulins. 3. Flexibility in treatment. Just like NPH and regular insulins, insulin detamere allows for individual treatment adjustments, helping doctors personalize therapy according to each patient's needs. So that's it, everyone. As we've seen, managing diabetes mellitus during pregnancy is crucial and requires a lot of attention. Everything needs to be done swiftly and accurately to ensure the health of both the mother and the baby. From lifestyle changes to blood sugar monitoring and, if necessary, insulin use, every step counts. So, if you or someone you know is in this phase, keep an eye on medical follow-ups and follow all the guidelines closely. I hope you learned a lot. If you liked the video, don't forget to like and subscribe to the channel so you don't miss more content like this. See you in the next video. Take care.